Good morning, hello, good afternoon, wherever you are today on Thursday, January 26th. Welcome to our practitioner call. My name is Kathleen Nichols, and I am a Senior Presidential Director here with LifeWave, and I have the pleasure this morning of filling in for Marcy, so I'm super excited to be here. And we have a very honorable guest that you guys all know and love today, Dr. Patty. So I'm going to have Dr. Patty unmute yourself and just give us a little bit of your background to start with, please.
Good morning, everyone. So I'm a medical doctor. I went to medical school after having a first career in music. I taught music, piano, and voice. I always had an interest in medicine. And so I was able to fulfill that dream and get sort of a Western medicine training, which I wanted to supplement what I'd already been doing as a layperson and continue to do now as a medical doctor. And that is study all of the other beautiful forms of healing that we have in the world, literally, to give us more tools in our tool belt as healers. So that might be, in addition to Western medicine, we have so many beautiful things like Ayurvedic and homeopathy and Chinese herbs and so on. And I highly respect all of those fields, including healing modes of acupuncture and chiropractic and so on. But I have a mostly remote practice now, although I do have a clinic in San Clemente, California, where I live. I help to manage other clinics all over the United States. I have medical license in several states, and other clinics that may not have a medical doctor, but would like to do things that would require a medical doctor's supervision. So I just enjoy doing functional medicine now, most primarily regenerative medicine. I started out doing internal medicine, primary care, occupational medicine, moved to corporate and environmental medicine. And now I'm doing mostly functional medicine, which is trying to get to the root of the problem. So it's nice to meet all of you and hope everyone's having a good day.
Wow, that's amazing, Patty, from the music and the arts all the way to medical field, and the list of your accomplishments and where you practice that is huge.
Oh, no, thank you. Thank you.
Quite the resume, yes. So I know everybody, so tell us a little bit about your personal, how you got introduced to the patches and your personal journey with it. I don't think I've ever heard it. Do you mind starting there?
Sure. So I had a patient that had quite a few problems that we were working on together. And she mentioned to me at one of the appointments that we had that the pain in her jaw had really improved using the patches, X39 and IceWave in particular. And I perked up on that because I was diagnosed a number of years ago with multiple sclerosis. I have some symptoms in that area, particularly pain at night. I don't identify with that disease, but right now that's the reality of what I work within. And so I thought, wow, I'd like to try that because I don't do well taking medications, even many supplements. And this made sense to me that, and yet it sounded impossible, too good to be true. But I reached out to the physician that had introduced her to the patches. And then I spoke to her, the physician, and then I began to do the research and look at all the research that David Schmidt has done. And realized that it appeared to be something that could be certainly safe for patients and potentially effective. And so that's how I got into it, started it myself, and have seen great benefits.
Amazing. And, we're so honored to have the medical professionals starting to understand that this is a tool in their toolbox. It's amazing that we have so many joining our team. So
yes.
Well, I know everybody's really anxious to hear what you have to say. So I know that we're kind of focusing on X49 today, but if you don't mind, if we could just start off a little bit on how X39 works, what is GHK copper peptide, what are some of the benefits people can expect, and then we'll do the same thing with X49 and then kind of compare the two. Does that sound good?
Sure. Sure, because X39 we know is our foundational patch. And I think, for people to sort of move off of that one or not to use it as a foundation, I think would be not wise, because it gives the foundation so that hopefully then other things can be even more effective, including X39. There's a big synergy. David Schmidt talks about that frequently between X39 and X49. And what synergy means is that you get just compounded benefits when you use the two together, much more than you might think. It's not like 1 + 1 is 2, but 1 + 1 is 10. And that's what we mean sort of by synergy. So the X39 patch activates in our own body a pathway called GHK copper. GHK is 3 amino acids in a chain, just short chain amino acid. And the copper is sort of the carrier molecule that helps to attach to GHK and bring it into the body and the cells for better use. And so as that pathway in our body is stimulated, and it particularly relates to pain, energy, and sleep, although we see many more benefits too, we find that then our body is activating more stem cells. And so we get the benefits of the regenerative effects of stem cells, the beautiful growth factors, and all kinds of healing chemicals that the stem cells release. And our body then begins to rejuvenate and repair.
Excellent. Yeah. And that's, as I'm listening to you, I'm quickly jotting down notes, because I never understood that it was a 3 amino acid change and that the copper was the carrier. That is, I'm glad to understand that in more of a detailed level. So thank you. And
Sure.
so then, yeah. And so then tell me how, so we put the patch on, of course, on the patching podcast, we talk about, it gets activated by our body heat and our light. Can you kind of talk a little bit about how that processes works?
Sure. And just a brief comment about the copper. David Schmidt talks frequently about it's important for us to make sure our bodies have enough copper in them to help activate the patch and to be even help it to work even better. And so that's something you might want to listen to some of his webinars about that, and ways you can use food in particular. You don't want to overload on copper either. So you don't want to just take a lot of copper supplement without, looking at things, but it is important that we have enough copper in our bodies. And I think that the light activation part of the patch is what really drew it to me. So like I have a patch on today right here, and you can see it looks like just like a little Band-Aid. And the center part of it is just a number of amino acids, sugars, and it's sort of like crystals that are cut in different shapes so they can reflect light. And our body produces one frequency of healing light called infrared light. And it sort of then exudes that light out. So it's sort of a process coming in and out. And what we want to do, we know infrared light is a healing frequency because you've probably seen it as an infrared light in a bed, in a gym that you can lie on after you work out, and it helps you to recover more quickly. Or your physical therapist may use that wand on you if you have an injury. And so what we want to do is we take that healing light our body naturally makes, and we just as it's coming out right here at this spot on my body in particular today, that little middle section there of the amino acid and sugar crystals is literally just sort of blocking that one spot to go right back into my body to help my body to make more of healing things. In this case, GHK copper is what we're particularly focused on, that gives us more stem cells. And so we're just taking our body's healing properties. But what happens is as we get sick, as we get older, as we get in toxic environments, we get stressed, we don't make our body doesn't do as well with its natural pathways, right? And so what we're doing is we're helping to stimulate that just a little bit more in our body by turning that back in so that it can do its healing work, the infrared light therapy. And that's what it's about. There's no chemicals, there's no drugs, there's nothing like that in the patch. Okay, and that was hard for me to get my head around. I heard about the glutathione patch and I was still thinking glutathione. No, we're just activating our body's pathways to produce more of whatever that particular patch is. And so in this case with X39, we're doing GHK copper. With X49, we're doing AHK copper. So the G-glycine in our GHK copper, those 3 amino acids, then in X49, we just changed alanine. So it's a different amino acid, but then it has similar functions as X39, but then also some very specific ones.
Okay, and just to go back for 1 second on the X39, I've been doing this for 3 years and wearing the patches for 3 years, and even last month I had a huge healing after wearing the patches 3 years. I had a huge healing from my illness 18 years ago. So that's amazing. And when I think about the broad reach of this patch, it really it really tells me that it's the GHK copper peptide that has that so many healing properties, and then the stem cells, and that combination is what allows that reach to be so broad and so encompassing. Is that accurate? Yeah,
that is, and I love that you're saying you're seeing things at 3 years. I continue to see things. I've been doing this since last May, and I noticed at about 7 months I started seeing more things than I had seen before. And I tell my patients, I want you to be on the patch as a minimum for what we would call regeneration, okay, and repair. Every decade you are old, you want to be on it a month to give it some time to have a repair. So if you're 50 years old, 5 months minimum. Some people will feel benefits before that. But if you're not, just know that there's lots of repair that needs to be done in our bodies. And we can trust through the studies that David Schmidt has done and shared with us that indeed it is working to release more copper peptide in our bodies.
Yeah, excellent. So I'm just going to hit a couple questions before we move on to AHK. So Heidi's asking, is there a certain type of copper that is best?
So what David Schmidt talks about is ways to get it through foods. And because I have seen copper imbalance, sometimes you can get zinc and copper imbalanced in the body. So I have people to take a copper supplement with great caution. I would suggest doing it in combination with a good multivitamin where you're getting a little copper, but you're also getting your other minerals. And so a good multivitamin, I would say, and then after that, through foods as you can. One of the best foods he always says is dark chocolate. Dark chocolate's always in the news because they find somebody has lead or cadmium or a few things like that in it. So you have to look at your sources, but we can all enjoy a little bit of dark chocolate too to make sure we've got enough copper.
Absolutely, that's the best news ever, right?
Yes.
And then we have another question, which is it best to wear X39 and X49 together? I've been wearing X39 during the day and X49 at night. Okay, so is it better to wear them at the same 12 hours, or is it okay to separate the 12 hours?
So I believe that the studies David has done, he has said he wears them and they've been worn in the studies together in the daytime. But then he also says that they could be worn at night. And from what I'm learning myself, and I tell my patients, medicine isn't just a science, it's an art, and it's an individualization and customization. So I would say there are benefits between, perhaps I wear mine both in the day. However, you could wear one at night, one in the day to sort of, in a sense, cover your body throughout. And that could certainly make sense. But the studies themselves that we have been done with them both being used during the day, is what I have heard him say.
Yeah.
Together.
Yeah,
Yes.
I prefer during the day too, because who wants to sleep through inspiration, motivation, joy, and energy, right?
Well, the
So,
good news is that they have the lingering benefit. Pretty much that's why we take that 12 hours off, to cycle and follow our body's normal sort of circadian rhythm cycles of peptides. But you're still going to hopefully feel that benefit. For example, the first day I wore literally X39, that night I slept so much better. I couldn't even believe it. So, they're pretty amazing.
yeah, absolutely. Yeah, their benefits go across the whole 24 hours. I was just
Right.
making a joke.
No, I know. I hear you. And it's actually quite, there's an insight there. It's not just a joke.
Yeah. So one more question before we go on to X49 more in depth. So someone, it appears, is having a rash where they're putting the X39 on the spine. Can you speak to that, Dr. Patty?
Sure. And let me just say, I forgot to mention at the beginning, but we always, put our disclaimer out there so that we can preserve LifeWave, and no one wants to get in any kind of trouble with the FDA about trying to say we're treating diseases, we're curing diseases. As David Schmidt says, we're using the LifeWave patches for general wellness. We can share some of our specific experiences that have happened to us in our case studies with ourselves and our patients. But we're not claiming to cure or treat any disease. And Jan actually spoke to this, I think, the best that I've ever heard. Jan, do you want to talk about what I do? Let me say this real quick, and then I'm going to let Jan just talk about how you can use it, putting it on your clothing as well. But I alternate my patch placement so that every day I'm using a little different spot. So like 2 finger widths below my belly button, one day might be more like 1 or 3, but it's going to be just where I'm not putting it in the same place each day. And I just alternate that enough to give my skin time. And I usually don't have any issues. Now, Jan recommended another option. Jan, is Jan here today?
Are we talking about Jan Rand?
Yes.
No, she is in Florida for the Sarasota.
Oh, she's
event.
there too.
Yeah.
Well, what she was talking about is that because the light emitted can be, it's coming out a distance, and you can actually put it on your sweater. So like I could take my sweater today and I could put the patch on the inside of my sweater, but it would be stuck to my sweater, and that it can work. And I believe I have heard a number of different people say that. I have not used that myself, and that's why I was going to let her speak to that, because I can't clarify that fully. I do know some people will stack one patch on top of another, and alternate different places in their body. But maybe when Jan's back next week, she could speak to that specifically about how you can use it through the clothing too.
Sure. Yeah, I know Dr. John Harmon puts patches on his sleeves, on his clothing, and wears it like that. And also what I find in my experience, just to address it, is a lot of times that maybe that little rash is just the initial couple days, the initial couple weeks. And with more water, it clears up. It can just be like a little bit of a detox, or something that clears up after more water intake. That's what I actually find. So,
Great. Thank you.
So Dr. Patty, let's dive into X49. I mean, let's go ahead and first talk about the Alanine and what X49 is meant to do, or how it's meant to help the body.
Sure. So Alanine is a little bit more narrowly focused than what the glycine in GHK copper is. So the AHK copper pathway is a little more narrowly focused. However, the more David's done research on it, he says that he's finding it's expanding a little more. So initially he was saying, certainly in the muscle tissue, he has studies that show definitely more strength and stamina. So muscle tissue, muscle fat burning into muscle better with that pathway being activated. And that's one of the main ones. Also the brain, which partners a bit with carnosine. We know it's also very good for our brain. One of the other things he's finding is bone. And they've done a study with, this happens to be with women, on bone density and building bone density. And of course, we know the more you exercise, weight-bearing exercise is one of the best ways to prevent osteoporosis, is to have weight-bearing exercise. So the more you're building muscle and exercising, the more that's going to help that. And even skin, he was saying that they're finding some good things about that too. Oh, and the heart. I knew I left something out. So it makes sense that, you're going to get more stamina. It's going to be better overall. You're activating something in the body called VEGF, which is an endothelial growth factor. What that means is on the inside of our blood vessel. That's called the endothelium. It's like that membrane on the inside of our blood vessels. And that membrane, when it gets damaged in any way, and often it does when we put a lot of plaque there, that plaque can break off and we know can cause a heart attack or stroke. So we want to keep our endothelium lining just beautiful. And so one thing that that AHK X49, AHK copper activates helps that endothelium lining to be better through activating a growth factor called a VEGF. And so we know that then that can contribute to better heart muscle, heart activation, and the heart working better overall based upon those physiologic pathways.
So to break it down a little bit, what I'm understanding is when you wear X49, it's like cleaning the inside of the cell. Is that in like lay terms? Is that how I could understand it? Or
so it's everything I would say that we do when we have stem cells. Stem cells are going to help us to clean up, and we know that we're always turning over new cells in our body, right? And there's debris. Glutathione is one of the best ways to sort of help remove some of that debris. But that's really what we're doing with X39 and 49 is helping to create more activation of stem cells. And overall, and over time, that helps. The X49 that I was speaking about in particular is helping to just maintain the membrane of the inside lining of your vessels. And so you want to make sure, maybe I misspoke, the endothelium lining is the inside lining of the vessels, the blood vessels, to keep that really nice and healthy. But of course, it will overall help our cells to be more regenerative and more active. Yes. Yeah. Thank you for clarifying.
Yeah. I'm just learning so much. I want to make sure I understand what you're saying.
Exactly.
Thank you for clarifying. And so then what happens? So the X49 works on the same exact light therapy that X39 does. It's the same technology, right? And so, but it's just how the crystals are cut differently so that they refract a different wavelength. Is that correct?
Yeah. So somehow that's why, David has about 70 studies on his batches or more now. And he also is very careful to understand the meridians of the body. We call those energy meridians in Eastern medicine. So areas where you can place them and activate what you want to activate. And so if you wear X39 and X49, let's say together in the day, he usually says to put X39 on the back of the neck, that spot there, the prominent bone that sticks out, and then X49 below the belly button. But he says in theory, you can put them anywhere and they will be helpful, but the studies have been done with them in those placements. Are you guys hearing a noise? Or are you okay?
I'm not hearing a noise.
Okay, perfect.
Yeah, okay. So I do know that also, so X39 is the broad, we like to say a holy grail of healing. And then X49, like you said, is more of a narrowed specific with the physical body. So I know there's been some really exciting things happening when we put the two together. What's going on when we put the two together as far as protecting our system from things?
Well, so we're activating two very regenerative pathways in our body. We know that we have, infinite numbers of regenerative pathways in our bodies, but these are ones that we have studied more and been able to find more about. So when you're using them together, you're going to get so many benefits. For example, X39 is going to ultimately give you more energy, right? And better sleep. So then you're going to be able to have better workouts, right? And it helps with that. And then we're using X49 when we're doing exercise to help us to convert fat into muscle, which makes us stronger and then gives us stronger bones. So it's just sort of that cycle that we go through that's actually pretty exciting. And one of the studies he did in 2 months, they were able to see more fat conversion into muscle, which was, they were, really excited about that because the diet itself had not changed. Exercise was a part of this, but the diet had not changed. Now, he's very quick to emphasize that you can't just eat anything you want and junk and expect to put on a patch, right? We don't want to do that. We want to keep our bodies as healthy as possible so they can respond and we can optimize our patches that we're using in the body through healthy diets and good exercise, lowering our stress and better sleep. But the patches will help us to do that and make it a little bit easier for us to follow through and be diligent instead of like most of the rest of the world. You start out January 1 with all these goals, and by the end of the month, like 90% of all people have dropped out already, so we want to be able to stick with it every day. And that's the beauty of the patches. There's something that, give us that every day.
Yes, absolutely. So I do know there's a big buzz going on with something happening is called a Faraday cage, correct?
Mm-hmm, mm-hmm.
So
Yes.
can you first tell us what a Faraday cage is?
So there may be somebody on that could speak to that better than I can. I can't tell you the details of it, but the idea is, we're all looking at 5G. And we're looking at, what happens to us with Wi-Fi and cell towers and all of that. So I can speak to it more generally, but anybody that wants to raise their hand and speak more, that'd be great. But what we're trying to do in particular with X39 as well, although X49, we're hearing a little bit more about it, but the two together can maybe help us to be a little more resilient. And some of those things that there's lots of controversy around 5G, right? And we know that many of us, they're putting towers up very close to our house. And many of us feel like that could really interfere with just sort of normal, healthy body signals. And so anything we can do to help protect us and be a little more resilient to those outside forces. And it's not just that, but it's, when we get glyphosate because we, get bread when we're out and we're not eating organic or something like that. We want to be more resilient because we know this is a pretty toxic world with the food, the water, the air. And so we do our best to bring in the best water, the best food, the best air, and to minimize our exposure, to try to use headphones instead of, this. And then even headphones sometimes are a bit, this is why I use this rather than a Bluetooth, because I believe it's better. But it's, it's hard to know for sure, but we're all doing our best. And so we feel like that the patches, particularly X49, can be more helpful for us against 5G and Wi-Fi and some of those exposures that we have. But I'm happy for anybody who might know even more about that to speak on that science.
Sure. Well, I've actually done some demonstrations on an event. Have you seen that, Dr. Patty, where they muscled? Oh, it's amazing.
Yeah.
So the other day I was asking someone, well, how do you think that Faraday cage actually gets kind of formed? And my sense of a Faraday cage is it's basically like almost like a shield that's going to block EMFs from coming into your body, or 5G, that type of radiation from coming into your body. So, and I don't know, how they knew this, but they said, that X39 is presenting in a vertical frequency, kind of sine wave, if you will, and X49 is horizontal. So the intersections of those two wavelengths was kind of creating the Faraday cage. So
Oh, that's great.
yeah, so I was like, okay, that made sense. So yeah, so what I've demonstrated in an event here on Maui last fall was, so you're wearing the X39 and you do not have the X49 on, and you have your phone up to your ear and someone calls. And so before that, we're going to muscle test, and the person's system is totally strong, which means a straight arm, they can't push it down. Then they put the phone up to them, and of course their arm goes straight down, which means your energy system just got completely weakened and you're being bombarded by the radiation of the phone. So here we go. And then you put the X49 anywhere on their body, and when the phone rings, their arm still is completely strong.
Oh, wow. That's great. Yeah, that's good. You need to promote that video even more. That's wonderful.
Yes. Yeah. I was actually on a hike on Monday with a woman who does EMF protection. So we're meeting up. But yeah,
Oh,
so that's,
great.
so I think, I mean, it's so fascinating, Dr. Patty, because, I don't think that was probably an original idea. I mean, I don't think that was what David had in mind when he was putting
a newer one. Yeah.
So it's like, what we're finding, and you can speak to this with your own experience in your patients, but what I'm finding is that the reach of these patches, and now the reach of the combination, is there's just all these fascinating things showing up that we're not necessarily expected, or we're looking for. They're just all these other, beautiful secondary consequences. Are you finding that?
I think so. And I find that the patients that I have that really are on a healthy diet, they take a few nutritional supplements, and they're exercising to the best of their capability, will see more benefit, because all of these do work in synergy with each other. And, if we're bombarding our body with sugar and fast food, then, there's only so much that something else can overcome. But if you're giving yourself the benefit and trying to reduce inflammation in every part of your body, then the stem cells can work for rejuvenation. So think about it. So if you've got a problem with your liver, okay, we need our liver to live, right? And so when you start using the patches and the stem cells are activated, they're like honing birds. They go right to that area of greatest inflammation. So you may not feel like you're getting any better sleep or feel any more energy, because they're having to do all their focus and work on the inflammation in your liver. We want them ultimately to have a shorter period of repair, like I said, maybe 50 years old, 5 months. But then we want to have the rejuvenation ability so that the stem cells can then begin to focus on inflammation. And we notice all of a sudden, we feel like our faces look better and our hair is doing what we wanted to do, and growing better and those things. But we don't need that to survive. So, you don't care if you have a wrinkle. That has, really nothing to do with, are you going to survive? But your liver, yes. So the more you can reduce inflammation through your lifestyle, you free up those stem cells to do the rejuvenative, beautiful work and regenerative work on your body over time. And that to me is what's really exciting. So I love what you said about using them and the muscle testing, because I do believe in that.
Yeah. Yeah. So basically what you're saying is over time, the scale really starts to tip and you really start to rejuvenate, as opposed to it just taking care of your immediate issues. So it's
right.
Yeah. And I think a lot of us on this call have been experiencing that. I know I have.
Yes.
So, and there was a question that lingered from last week, which, Heidi, can you unmute yourself and speak to that? Because I'm a little confused on that question.
Okay. Last week, Dr. Patty, there were some comments. There was a little bit of confusion in the chat that didn't get answered. And the question was on the type of, let's see, where did I write it in my notes? The cells that are created. We know that there's pluribabies, and then the cells kind of go into different, types of cells. You mentioned mesenchymal adult cells. that X39 creates that type of cell. And the question is, oh, I thought it was pluripotent. And so can you just give a better description of the difference between like mesenchymal and pluripotent? I know pluripotent can turn into any type of cell that's needed within the body. I do know that, but is that clear, my question? Based on
Yeah, yes. And that's a real technical question. And I've studied that in detail because I wanted to really, before I ever got into using stem cells on my patients, and I was using stem cells for myself and for my patients until the FDA has not been allowing that. We were using them at IV and intranasal and so on. You have to go to another country to do that now. There are some regenerative products that still can be used mainly in joint injections and for skin and wounds. But as I began to really study all of this and to understand, so mesenchymal stem cells, that's like an umbrella, that's a name. And underneath that are the multipotent, which is basically what we are activating. Pluripotent has a little more ability to turn into many different cells, but by the time we get to be adults, the pluripotency is not, you probably could not ever say never, but basically we work with multipotent mesenchymal stem cells. There are pluripotent that can turn into many cells of the body. There's the totipotent, T-O-T-I, totipotent, that can do even more. And then you move up to the embryonic. So I would say the most involved course I ever took in medical school was what we called embryology. And any of you, if you might have majored in biology in college, you took an embryology class. And it is unbelievable to see how the human is formed and how the cells differentiate, and ultimately they know to make one head and two arms, and it's just amazing. I happen to be a Christian, and so I attribute that creation to God, but it's just fabulous. But our body then knows how to turn that off so we don't make a second head, we don't make, four arms or whatever. And so as we move down and begin to do what we call differentiate in creating our body, in the womb, ultimately then the baby's born, and we don't ever worry, even though the baby has an amazing amount of stem cells, we don't worry that, I hope the baby doesn't create too many fingers or heads or whatever, because that process is done. And so as we then begin to get a little bit older, we have that differentiation. So our body is especially regenerative, and we do regenerate new neurons in our body. We can regenerate even ligaments, tendons, cartilage, collagen, all of those things with the proper support. My daughter's a perfect example. When she was 16, she was a volleyball player and she sort of ripped her knee and had to have surgery. And we started taking a supplement, glucosamine chondroitin at that time, a specific one called Cosamin that had been shown to actually help regenerate cartilage. And they had a before and after picture after we did this. And she did actually, her body regenerated some of its own cartilage, even without stem cells. She was 16. So we do have some ability to do that. But the multipotent is basically the mesenchymal type of stem cell. It's a type of mesenchymal stem cell that we mostly have that can regenerate and do many things in the body, but it can't actually create another head or another arm or whatever, which is good. We don't want to be having a patch that could cause us a problem, right? So that's why we look at multipotent mesenchymal stem cells, are the type that we mostly are having and producing in our bodies at this time.
Thank you for sharing that. I actually, for the first time in 3 years, had one of my potential customers ask me if he was going to grow an extra head or an arm or something. And I just kind of found that a profound question at this point. But first time I heard of it, people do think of that kind of stuff.
Well, they do. And it's because we do research with embryonic stem cells. And so, and then you hear about things happening that are really crazy or whatever. And so that's what they hear in their mind. And it sometimes can freak people out. I've dealt with a lot of patients like that too. I hear you.
Yeah. Awesome. Thank you, Heidi. And so I'm going to look at the chat and see what we have going on here. And so Yana wants to know, well, we're not going to talk specifically about diseases, Yana. So I'll address your second question, which is when you state stem cell activation regeneration is the light technology activating the cells. So yes, right. It's we're reflecting a wavelength that's activating that communication system.
That's correct.
Okay, perfect. Let's see what else we have here.
And David Schmidt does have studies that show that they are able to document that.
Yes. So a lot of that was around that same question. Someone's wanting to know, how does the patch actually reset the 4,000 genes in that first 24, 48 hours?
I'm not sure we can say that it truly resets 4,000 genes in 24 hours, okay? But what we can say is that it's starting a process of regeneration. And so we have to be careful what we claim. That's just too much, for anybody to really even believe. And we want to make sure that we have studies that show what we're saying is true so that we can back that up. That's important. So I think what we can say is, at least over time, and it's truly what we were sharing earlier about seeing new kinds of healings over months and now years of time that Kathleen was sharing about. So I think that what David Schmidt says is that the GHK copper peptide pathway, that it regenerates about 1/3 of the genes, about 4,000, that's about 4,000, that it has that capability to make that happen in our bodies, right? And so the more we support that with healthy lifestyles, the quicker that can happen. And the more we'll see that we're sort of turning ourselves back to an era where we were in our 20s and 30s, when we had plenty of energy, we could work out, we had libidos, we had good brains, we had muscles and fat burned, into muscle like we wanted it to. And that's what we're sort of going back to and trying to make that better. One thing about the X39, X49 as well is that he's noticed, and I believe they're going to at least try to do some studies, if not already, on thyroid, because he believes that the mechanism, the physiologic mechanism of AHK copper can also be helpful for thyroid. And then that sort of goes back to, you think about, that's where the thyroid, if it's not healthy, often it can be really damaged with radiation, right? So it makes sense that that could be helpful. So there's so many things going on there.
Yes, thank you. And that's what I've heard David say also too, is, the first patch is increasing antioxidants, decreasing inflammation, and that 1/3 of our human genome is being put back to a younger expression. So that's a lot more of an accurate statement. So thank you for clarifying that. So let's see what else, what other questions we have. So there's a lot of, how about can you tell us what your favorite patches are, Dr. Patty?
Sure. So the Ice Wave and X39 are where I started, just like my patient had mentioned. And the Ice Wave is my absolute favorite because for some of us, it does appear to be like magic. It literally, you put 2 patches on, one's a positively charged, one's a negatively charged, and you interrupt that pain signal and you can feel almost instant relief. So I love the Ice Wave. The idea is that over time, we use and repair whatever is causing that pain so that we get to the root cause of that pain, right? But in the interim, while we're doing that repair, we have the ability to actually relieve some of our pain, like I have been able to do at night for myself. And that's wonderful. So those are 2 of my favorite patches, but I'm a patch lady. Like Marcy, she talks about that too. I just figure the more the better, which is very unusual for me because I often tell my patients less is more. But on the patches, because I believe they're helping my body as it's aging and as it tends to be so over vigilant with autoimmune issues, to balance it. And so I love using all the patches. And some of you might have been on a few weeks ago when one of our members suggested that or asked if I had looked at Nirvana for pain. And I said, not really, I'll do that. And I have been using Nirvana now. I don't know if it's been as much as 4 weeks, maybe about. And I have found some additional pain relief with Nirvana. And I just recently started taking the little tablets just to see if I could feel any difference. And I will say that I think I have just a bit of a calmer sense of well-being during the day. It's sort of interesting. And I think I sleep even a little more deeply at night. So I'm really enjoying using a Nirvana, and I'm thankful for that. So I love them all.
Yes, yes. I also I'm wearing all kinds of patches all the time, but I'm absolutely with you with the ice wave. You know, I just had a customer last week and she got the ice wave, and so she called me up and we're going to put it on together over the phone. And she's, you know, moving it around, and then there's just silence on the phone. And the next thing I hear, she's sobbing, right? Because her pain is completely gone. And I started crying, she's crying. And I'm like, this is why we share the patches. So
Exactly.
yeah, that ice wave can just be like such a miracle for people when they've been in pain for so long. And it's interesting that you talk about their Nirvana for pain, because I recently got turned on to the same concept. And it was presented to me that Nirvana would be really helpful for nerve pain, for blocking the nerve pain impulse.
Mm-hmm.
And so I have someone on it right now that has severe nerve pain, and the person that recommended it said that within about 2 or 3 weeks, they thought that it would minimize that impulse as far as the nerve pain. So.
And you're increasing, see more of your endorphins. And we know that I can think I've got a pain, but if I get on a call like this, I haven't thought about my pain at all this whole time because I'm focused, you see, and I'm producing more endorphins. And I feel like maybe I could be helping someone. Same thing if I'm with a patient, or you pick up the phone, you know, and it's a friend. As we laugh and increase our endorphins, that in itself, humming, singing, all of those things actually do help us to have natural painkillers in our body. So I love the fact that Nirvana C is going to work on that area in my body. The ice wave is actually blocking that electrical signal. And so we get some benefit. Carnosine also can help some with pain, and certainly X39, that's one of its main things. And many people talk about how it's helped them with pain. So it is very exciting. And I think the patches, it is an art, and we can, you know, work with that together. So.
Yeah, excellent. And are you having success with sharing it with your patients and all different ailments or symptoms that it's helping with?
Yes, and let's see, February 9th, I'm going to be on a call with Susan Allen, and we have a couple of protocols there that we've put together. Again, not to cure or treat diseases, but I can tell you, I've had some amazing situations with diseases that cause severe pain, and how I've been able to interrupt that signal through using Ice Wave, Eon. David Schmidt talks a lot about Eon, using X39 X49 and Eon. If you've got like a pain on your elbow, stick the Eon right there on it. So we have a number of different tools, then they all work. The patches work activating different parts of our body that are naturally have naturally healing properties. And so it makes sense to sort of tune into that and see what can be helpful. And I had a patient just recently who's had knee problems ever since he was a younger man, and he's in his 50s now, and he has some neuropathic pain in that same leg. And just with Eon and Ice Wave, we interrupted that, and he said, you know, hadn't had that for decades of that kind of relief, just within, a few minutes. So it is pretty amazing. And then that helps to get patients going, okay, wait a minute, let me see what I can do with lifestyle and adding X39 and how that's going to help. And so hopefully we can get that beauty, to everybody.
Wow, that sounds amazing, Dr. Patty, that you're going to be on. So that's with Susan Allen on February 9th.
It is. And we'll talk about some more specific patching protocols for pain and not just for pain, but for some other things too. Yes.
Yeah, that's amazing. And thank you so much for all your time and for getting on these podcasts and helping us all to understand the technology, to really help and support our beloveds on how to place it and different protocols. So I just really appreciate your dedication and your knowledge and wisdom.
And you too. I appreciate everybody. And it's so good to see you. And I just hope everybody has a wonderful week. And we'll talk again soon.
Okay, awesome. Is there any last remaining quick questions that we could do, or everyone's saying thank you, thank you? Yes, definitely. Oh, definitely mark your calendar for February 9th. That's going to be something I'm going to be on. And thank you so much, Dr. Patty.
Yes, bless you guys. Have a good day. Bye-bye now. Thank you.
Goodbye,
Thank
everybody.
you, guys.
Thank you, Kathleen,
Aloha.
for jumping in.